Well, if you've taken the papers this morning, then you notice it's a top headline that we're seeing, the Philadelphia Inquirer. City advises against indoor Yule parties. And then this next one, crappy holidays. Look at that. All because of the announcement that Dr. Bettigol said, don't have indoor Christmas parties. And she is our top health official in Philadelphia. So I want to bring in Dr. John Wherry from Penn's Institute for Immunology about this news. Do you agree with Dr. Bettigol that we should not have, of course she said, it's keep your immediate family, but if you're coming from separate households, you should probably not all gather together indoors for the holidays.
Yeah, I do agree. I mean, we know that most transmission occurs in the household. That's because, of course, you spend the most time with your family. What she also said is if you are going to gather, make sure you can get everybody tested before you gather. Make sure everybody's vaccinated. This will decrease the chances that people in your family get sick. Older relatives are more vulnerable, people who are immunocompromised. So it's a good idea to keep the holiday gatherings small, and if you can, ask everybody to test beforehand.
And this is, even if you're vaccinated, you think that folks should be getting tests?
I do.
Okay.
Vaccinated people can still get infected. They don't get as sick, but they can certainly transmit. And the people who are really vulnerable, even if they're vaccinated, then could end up in the hospital.
So what do you say to the folks that are saying, well, the CDC said we could, Dr. Fauci said we can gather together?
Yeah, I think what we're seeing in Pennsylvania are higher transmission rates. Pennsylvania has the highest rate of hospitalization in the country this past week.
Why do you think that is?
I think it's a variety of things. The epidemic has moved from the north, sort of Midwest, Northeast, down into Pennsylvania. We have a pretty high rate of unvaccinated people in the central parts of the state. We're also seeing our healthcare systems get overwhelmed. And so we're seeing rates rising in the Philadelphia area as well, even though we have a higher vaccination rate. So we are seeing a lot of transmission despite the fact that people are vaccinated.
So you think maybe the CDC might change their recommendation? Or you just think more specific to us, we might need to move differently?
Yeah, I think the CDC has given local areas the discretion to make their own decisions, and that's based on local numbers of hospitalization and transmission rates. And what we're seeing in Pennsylvania is actually quite concerning right now.
It must be concerning because the news about Governor Wolf, he called for FEMA to come in. And what does he want FEMA to do?
So he wants FEMA to send in more healthcare workers. He also wants FEMA to send in 1 million new at-home tests, monoclonal antibodies to treat early in disease. So we're seeing a real shortage of healthcare workers unable to keep up with the number of patients coming into the hospital. And I should make clear, that's not just COVID patients. When hospitals are overwhelmed with COVID patients, your heart attack, your accident victims, your other medical emergencies can't get treated as effectively. So we're seeing a real difficulty in that in Pennsylvania. And
you mentioned already Central PA, but there are some counties, a lot of counties in our area that are really seeing an increase. That's
right. So 3 of the 5 fastest increases for counties in Pennsylvania are Philadelphia, Delaware, and Montgomery. So we're seeing—
And Bucks, right?
And Bucks and Northampton. So we're seeing increased rates of COVID transmission in the Philadelphia area. Increased rates of hospitalization are also beginning to occur in Philadelphia.
How soon? I mean, I guess it sounds like we need FEMA now.
We need FEMA now, absolutely, as soon as possible.
And I guess we already thought with winter and with gatherings that we're going to see an uptick. Was this what we were predicting then when we said, oh, when things get colder, folks go inside more? Yeah,
I think we were predicting an uptick. We're seeing a major wave of Delta. That's probably more than any of us expected, but we were expecting to see that uptick, especially after the Thanksgiving holidays. I think that's what's also prompting some recommendations around the Christmas and New Year's holidays, given that the Thanksgiving holidays probably exacerbated this wave of Delta that we're seeing.
So you think it's Delta? Because I feel like recently all the news and everyone's been talking about Omicron. That's been the focus. But I guess we're starting to forget that Delta's still here.
Delta's still here in the Delaware Valley. Delta is still the vast majority of cases that we're seeing detected. We're seeing an increase in Omicron, and just yesterday about 10% of cases in New Jersey were Omicron. Omicron will get here, but right now the majority is still Delta.
So since we have, as we talk about COVID and the different variants, and they have their own names, Delta, Omicron, the question is now becoming, do you think we'll need specific boosters for these different variants that we're seeing? Here's Dr. Fauci and what he said about this. It'll be coming.
At this point, there is no need for a variant-specific booster. And so the message remains clear. If you are unvaccinated, get vaccinated, and particularly in the arena of Omicron, if you are fully vaccinated, get your booster shot.
Do you agree that
Absolutely.
We don't need a variant specific? Because it is frustrating. You say, oh, get your vaccine, and it's like, oh, wait, but now there's a new variant, and it doesn't really help with that.
No, absolutely. Boosters clearly boost our immunity to Omicron. The data on that's actually pretty clear so far. We know that vaccines still protect somewhat from Omicron. They clearly seem to protect from severe disease. The booster boosts your antibodies somewhere between 20 and 40 times. And so your antibody levels go up. That gives you increased protection against Omicron. We don't have an Omicron-specific booster yet, so the best thing you can do is initially get vaccinated and then get your booster if you're eligible.
The thing is, though, there are requirements in some areas, and of course, Philly's going to have one soon for the vaccine, but not for boosters. So it's interesting how people are making that decision. But when it comes to universities, some are starting to require boosters. Do you think that the universities should be doing that?
Yeah, I do. I mean, we see, for example, Cornell has about 5% of their students are COVID positive, and they have an over 90% vaccination rate. Now, younger folks, college-age people aren't getting severely ill, but they're bringing that COVID home to their families, to older relatives. So it's a good idea to boost that level of immunity wherever we can.
And what about Princeton? They decided to move all their final exams to virtual, and they're starting to adjust some things. Do you think that other universities should just be making this move and get ahead of it? Or do you think it's just specific to the number of cases you're seeing at certain campuses?
Yeah, I think all universities are going to have to make individual decisions based on the number of cases they're seeing locally, the rates of transmission. I do think we're going to see other universities follow suit and change the way we're going into finals and maybe even the beginning of next semester.
Which some have already done. Like once you leave for the break, they said, hey, it's going to be like maybe the next semester or a couple of weeks before you come back.
That's right.
So we are starting to see that preemptively.
That's right. That's right. And many ask for the students to get boosters before they come back or by the end of January.
Mm-hmm. So here we are. Okay. So when it comes to with Dr. Bedigol then and her recommendation, it's just literally, because you might say, oh, well, we see them all the time. It's even if you see this person often, if they're in a different household, get tested.
If you're going to have groups of people, the best thing you can do is ask everyone to take a rapid test before you get together.
Okay, take that rapid test. Thank you so much. Because we still feel like they're just as accurate as a PCR and all that now.
The rapid at-home tests are still fantastic.
Okay.